Hello, this is Kim Jong-il. We are going to cover the topic strategic bonding for extraction treatment. After diagnosis, we are going to figure out which teeth to bond first. There are premolar extraction cases like as upper and lower first premolar extraction, upper first premolar, and the lower second premolar extraction. We can treat only the upper first premolar extraction, like the way that the first premolar of the upper and lower extraction is treated. Also, only the upper second premolar extraction, or the upper and lower second premolar extraction can be treated like the way that the upper U44, L55 extraction. The general treatment is that the upper first premolar and the lower second premolar extraction. In this case, the UOP is normal, POP is steep, and steep POP needs to be changed. We covered retrusive control in the premolar extraction cases. In the U44, L44 extraction case, it is the right direction that the upper canine is moved backwards, and the lower premolar is moved forward like the blue line. However, in the initial treatment, if the upper second premolar, which has a red line, is moved forward first, or the lower canine is moved backwards first, even though we can close the extraction space easily, finishing becomes harder. In other words, if retrusive control collapses, finishing becomes harder. Let's look at it as U55, L55 extraction case. In this case, if the upper first premolar is moved backwards first like the blue line, it would lead to good results. On the other hand, if the lower first premolar is moved backward first, the retrusive control would collapse. We should consider these cases during treatment. How about U44, L55 extraction case like B? Because the lower premolar cusp is facing the fossa marginal ridge on the upper premolar, even though the extraction space is closed or the teeth are moved either way, we could have good results. We need to think of how to bond strategically for the upper tooth number 4, the lower tooth number 5, the lower tooth number 4, and the upper tooth number 5 extraction case. In this case, we need to modify UOP and POP. In the upper first premolar extraction, if the upper canine is moved backwards, there must be expected tooth movement. The upper incisors would be extruded while the upper canine is moved backwards. Because of this, the upper incisor torque would be lost. What does this mean? It means that the UOP itself would steepen. Let's look at this patient. UOP is 11.7 degrees and POP is 18.3 degrees. It is normal, UOP and steep POP. The patient visited us with protruded lips and has class 1 canine relationship and class 1 molar relationship. In this case, to reinforce anchorage, the appliances are attached to the upper second molar and the upper anterior teeth are moved backwards. What tooth movement would happen? It is likely for the upper incisors to be extruded. If POP is steep, we should flatten it. Is it helpful for treatment or not? We should consider whether the appliances are attached to the upper tooth number 7 or lower tooth number 7 in the beginning. Let's look at the previous patient. POP is steep. What does this mean? It means that the upper second molar is mesially inclined. Many attach appliances to tooth number 7. How do the teeth move after leveling? While leveling, the upper anterior teeth would be extruded and UOP would become steep. To compensate for this, mini screws are used to raise. However, if tooth number 6 and 7 already has steep POP, the anterior teeth are extruded, and it is likely for the UOP itself to become steep. On the other hand, what does the blue line mean? It means UOP. In most cases, if the UOP is normal, there is a big gap compared to steep and UOP. In MEAW treatment, if the UOP is normal, the extraction space is closed with UOP maintained. The space closure should be made with the UOP maintained. In some orthodontic techniques, appliances are attached to tooth number 7 and omega roof, or helix is applied, then every arch wire can be bent. However, in MEAW treatment, it is not necessary. In other words, when closing the extraction space, appliance is attached to tooth number 6, not to tooth number 7 in the beginning, then it is preferable for the upper canine to be moved backwards. Of course, the upper tooth number 6 itself would be slightly moved forward. However, in most cases with normal UOP, if the upper tooth number 6 is pulled to tooth number 3 for the case that the upper tooth number 6 is uprighted and has parallel rotation, the space closure can be made with the UOP maintained. The cases moving the upper canine backwards can be classified into 3 types. In the case B that there is upper anterior crowding, the upper canine can be moved backwards by using open coil spring on crowding. In the case A, appliances can be attached to teeth number 1, 2, 3, 5, and 6. In the case C, appliances are not attached to teeth number 1 and 2 in the beginning. You need to check which type the case belongs to. In the upper first premolar extraction cases, appliances can be attached to teeth number 1, 2, 3, 5, and 6, or teeth number 3, 5, and 6. Or the anchorage is reinforced by attaching appliances to teeth number 3, 5, 6, and 7 to prevent the upper incisors from extrusion. There are many cases where the skeletal pattern is class 2, but the denture pattern is class 1. What does this mean? It means that the lower molar on the right side is more mesially inclined like this patient. Mesial inclination in the lower molar shows steep POP. If it is steep POP, we should flatten it. In other words, the teeth should be rotated counterclockwise. By rotation, the mandibular moved forward and condyle is also taken off. The character of class 2 malocclusion is steep POP. Even though molar relationship is class 1, if POP is steep, the maxillary incisors would be extruded. Steep POP should be flattened. To do so, I have already commented that the lower second premolar should be extracted. In the lower second premolar extraction, you might wonder about a few things. Whether appliances should be attached to the lower tooth number 7 in the beginning or not. Whether appliances should be attached to the lower canine or not. I also used to attach appliances to lower tooth number 7 for the first case. Even though the appliances are attached to lower teeth number 6 and 7, the teeth are not moved forward. What would happen? If the lower anterior teeth are extruded, it is likely for the curve of SPE to worsen. The appliances are attached to the lower second molar in the initial stage, but the appliances are not attached to the lower second molar now. Appliances are not attached to the lower second molar to align anterior teeth. To upright the lower first molar, mesially inclined, and to move the teeth forward. If the appliances are attached to the lower second molar, the teeth number 6 and 7 works as a 1 unit, so they are not likely to be moved forward. In the conventional orthodontics, if there is class 2 malocclusion, the lower tooth number 5 would be extracted. After the extraction, if the space closure is made, the curve of SPE would worsen. Of course, we can make it flat by MEAW, but it would be easier if treatment is performed without initial bonding. In MEAW orthodontic, appliances are attached to tooth number 6, not to tooth number 7. The lower first premolar, mesially inclined, is uprighted and aligns the anterior crowding, then 8 teeth become anchorage. This is the basic concept of MEAW orthodontics that close the extraction space. In the second case, the point is whether to attach appliances to the lower canine or not. I had attached appliances to the lower canine in the initial stage if there is no crowding. If the extraction space is closed while attaching the appliances, there would not be the space where the lower first premolar is uprighted. So the lower tooth number 6 area should be more mesially inclined. It is better to control the occlusal plane, minimizing this. So even though there is no canine crowding, appliances should not be attached to the lower canine in the initial stage. An open coil spring can be used on the tooth number 3 area to upright the lower first premolar, mesially inclined. Then the extraction space can be somewhat closed. After that, when the space closure is made, space closure becomes easier. In U44, L55 extraction case, appliances are initially attached to the lower teeth number 1, 2, 4, and 6. Then the open coil spring is used in the lower canine. The space closure is made in the upper teeth number 1, 2, 3, 5, and 6. Then, the canine would be moved backward first. The upper premolar also is moved anteriorly. The upper premolar will meet the lower premolar. In other words, the retrusive control is made naturally. In the lower second premolar extraction cases, you should remember the following. Appliances are initially attached to the lower teeth number 1, 2, 4, and 6. Next, the initial arch wire 04 niti is applied, and then an open coil spring is used. After that, a tight cinch back is applied. If the lower anterior crowding is dissolved and the lower first premolar, mesially inclined, is uprighted, the curve of SPE could be flattened. After that, if the appliances are attached to the canine, it becomes easier to solve deep overbite, and the curve of SPE is prevented from worsening. And then, the extraction space is closed. When the space closure is made, the appliances are extended to the mandibular tooth number 7, and releveling is made. Then, MEAW is applied. As such, the lower second premolar extraction. It can be treated like the upper second premolar extraction case is treated. After the treatment, the anterior teeth are moved backward by 80%, and the posterior teeth are moved forward by about 10 to 20%. If so, the treatment becomes easier. You should remember the following. In U44, L55 extraction cases, the strategic bonding is used to on the upper teeth number 1, 2, 4, 5, and 6, and in the lower teeth number 1, 2, 4, and 6, and the open coil spring is used to tooth number 3 area. If the tooth number 32 and 30s is mesially inclined, it would be difficult for open coil spring to be attached. Then, it can be used later. First, if we make the lower 3 incisors be able to be leveled and open coil spring is used, the extraction space would be closed and dissolving the anterior crowding. The space can be created. And then, if appliances are attached to the rest of the teeth, the leveling would be easier. Let's take a look at the lower first premolar extraction cases. In the lower first premolar extraction cases, appliances are attached to the tooth number 7 for maximum anchorage, or appliances are attached to the tooth number 6 to prevent the molar from being moved forward. Even though the appliances are attached like B, the lower teeth number 5 and 6 are not likely to be moved forward. So, I use open coil spring to tooth number 6 in the lower first premolar extraction cases. The appliances are not attached to tooth number 6 in the initial stage. If appliances are attached to the tooth number 1, 2, 3, 5, and 7, open coil spring is used to tooth number 6. The teeth would be mesially inclined. The lower second premolar would be upright, then it would be parallel rotated. Also, the second premolar would be moved a little forward. Let's review. In the lower first premolar extraction cases, what would happen if the lower canine are moved backward? If the canine is moved backwards, the canine relationship would break up. This is not good. What if the lower second premolar are moved forward? The retrusive control becomes better. To do so, the open coil spring is used to the lower tooth number 6 area. In the lower first premolar extraction cases, the appliances are attached to lower teeth number 1, 2, 3, 5, and 7. In the first premolar extraction cases, short class 2 elastics can be used between upper canine to lower tooth number 5. In this case, the occlusal place becomes steep and the upper anterior teeth would be extruded. This is not the teeth movement we expected. In this case, if open coil spring is used instead of short class 2 elastics, the lower second premolar would be placed more anteriorly. If so, when the upper canine is moved backwards, even though upper tooth number 6 and lower second premolar is moved a little forward, retrusive control doesn't change. How should we strategically bond initially in the second premolar extraction cases? Appliances should be attached to teeth number 1, 2, 4, and 6 like the lower second premolar extraction cases. Open coil spring is applied to tooth number 3 area. In this case, when the open coil spring is applied to tooth number 3 area, the upper first premolar is moved backwards first. After using an open coil spring on the maxillary for a month, it is better to use an open coil spring on the lower canine. In other words, the lower first premolar should not be first moved backwards. In the tooth number 5 extraction case, appliances are attached to teeth 1, 2, 4, and 6. In the strategic bonding cases, we learned first premolar extraction cases and upper first premolar and lower second premolar extraction cases. In this case, in the upper first premolar extraction cases, appliances are attached to the upper teeth number 1, 2, 3, 5, and 6, and in the lower tooth number 5 extraction cases, appliances are attached to lower teeth number 1, 2, 4, and 6. However, in the lower first premolar extraction cases, appliances would be attached to lower teeth number 1, 2, 3, 5, and 7. The case that only the upper first premolar is extracted is the same. Then it is non-extraction case in the lower. In the non-extraction cases, appliances are attached to the lower teeth number 1, 2, 3, 4, 5, and 7, and the open coil spring is applied to tooth number 6 area. What about the upper second premolar extraction cases? Appliances are attached to upper teeth number 1, 2, 4, and 6, and the lower teeth number 1, 2, 3, 4, 5, and 7, and none of the teeth in the mandible is extracted. In the upper second premolar and the mandibular second premolar extraction cases, appliances are attached to upper teeth number 1, 2, 4, and 6, then open coil spring is used first. And open coil spring would be applied to the lower canine next month. When you diagnose and attach the appliances based on diagnosis, if you treat like this, you would have positive results. Thank you for watching.